Hello and welcome to our webinar on prophecy assessments. My name is Tom DeSantis from Advanced Practice Strategies. I want to thank you for joining today's discussion on the ROI and impact of using validated assessments to reduce nurse turnover. Right now you're all set to mute, but if you have any questions at any time, just type it in the question box for the Q&A at the end of the presentation. When planning for today's discussion, we tried to put ourselves in your shoes and came up with the questions we thought you'd have. This is how we framed our agenda. We'll explain on a high level what is prophecy and what problems does it solve. We'll talk about how it is used in the hiring process. We'll show how its data is used to personalize onboarding. We'll show how clients have increased retention. And we'll demonstrate the cost savings you can achieve and are actually being realized right now at health systems just like yours. Before we get started, I wanted to explain who we are. Advanced Practice Strategies is a technology company that works with U.S. health systems to build the best patient care teams. We have two products, Gnosis, our analytics and learning platform, and Prophecy, our nurse assessment solution. As you know, today we're here to talk about prophecy. To do that, I'm fortunate to have my colleague Felicia Sadler with us. Felicia is our Vice President of Quality and Performance. She collaborates with clients, specifically during the hands-on implementation and training, to provide strategic solutions to increase nurse retention, promote efficiency in onboarding, and improve nurse satisfaction scores with prophecy assessments. Felicia has been a registered nurse for over 30 years and served in numerous leadership capacities, including healthcare administration, where, with her passion for continuous quality improvement, she specializes in improving clinical excellence. She's currently on the Ashram's Education Development Task Force and has served as a board examiner for the Tennessee Center for Performance Excellence. Welcome, Felicia.
Thank you so much, Tom. And welcome, everybody. Thank you for joining us. We'll go right into the problem that we all in healthcare have experienced over the years, and that is that same theme around high nurse turnover, where the average U.S. turnover rate is around 17%. There is a turnover cost associated with this average percentage of $10,000 all the way up to $88,000, depending on your organization. The solution that Prophecy does provide, it really has data behind it to improve your processes as it relates to hiring, onboarding, and developing your new employees, as well as your new nurses. You can also use it for ongoing competency assessments as well. So in hiring, how do we know we are selecting and placing the best fit, the best people in the right position? For onboarding, how do we develop those nurses using a data-driven approach? And then developing, how can we maintain those competencies ongoing, identify those potential emerging leaders as far as part of our succession planning process. When it comes to the evidence, we know that with Prophecy, we have been able to test at least 30% of nurses, of all U.S. nurses. They have gone through the Prophecy assessments in the last 6 years. We do offer 78 validated competency assessments, and as a total of assessments that have been completed, we're at 6 million plus, which is fantastic. We do offer 3 assessments using a holistic approach. We offer the clinical competency assessments, which measures that hard job knowledge, the technical knowledge related to a particular specialty or position. We offer the situational assessments, which measure the soft skills that are essential to the patient experience, for example. How would someone interact with a physician, the patients, and the families? As well as the behavioral assessment. How does an individual engage with their team? Do they have the right personality and traits that are essential to job fit when it comes to a particular role, clinical role? The clinical assessments do measure how an individual is, how much knowledge they have when it pertains to administering medications, report transitioning, how are they when it comes to critical thinking, problem solving, assertiveness. Our clinical assessments are in 78 specialties, and we do also have the dysrhythmia assessment, which we're looking at that one right now, and looking at the modified ANGOLF of 76%, the caregiver scored 80%. You will know if they've either passed or failed. And we do provide you with the job knowledge score breakdowns as well, so you can really target in and hone in those areas of deficit. With the situational assessment, this is the soft skills assessment, measuring how they interact with patients and families, how are they when it comes to developing relationships, verbal communication, customer service, which really plays into that patient experience. And then we also provide you with a sub-score breakdown as well, so you can really, once again, hone in on those areas of deficit. The behavioral assessment measures the personality traits, which really speaks to the job fit. How are they when it comes to accountability, honesty and conscientiousness, resolving conflicts, and you're provided with a job fit percentage score. How well is someone suited to a particular job role just based on their personality attributes. Pulling together all three assessments, we can provide you with one score of expected job success. These are statistically weighted, and it goes into the expected job success percentage score. It combines all three components, and we do have these available in over 13 nursing specialties. With all the information that you receive from the assessment and scorecards, you can then pull together our analytics report, and that we will provide you on how well your applicant or your new hire or your nurse scored and compared across the nation. You have the Angoff cutoff or pass-fail cutoff score, and then you can also see how they're spread across the scatter plot. You can also hone in and target on individuals to see how well they scored in comparison to facilities, departments, and then you can also filter out the dates as well. Looking from a behavioral analytics standpoint, you can also determine the best fit, how well suited that someone is for a particular role. You're provided this, the best fit in the report itself, but then you can also look out across to multiple specialties to see if there might be another area that they could actually go into or transition into. And then looking at the situational and interpersonal competence, so it actually provides you with a score breakdown for how they are when it comes to collaboration, resolving conflicts, and allows you to really target those areas and develop individual or customized reports and learning plan based off of the analytics piece. You can also customize the orientation process as it relates to the interpersonal competence and med-surg. You can look at this from an individual perspective as well as a group or cohort perspective. So how are our organizations finding success when it comes to prophecy implementation? Here's one example of a regional health system in Michigan. They actually experienced a 53% reduction in their turnover. Without prophecy, it was 11.8%. With prophecy, it was 5.6%. And they were actually utilizing the assessments from a pre-hire perspective as well as from an onboarding perspective. This is one organization who actually has experienced a 9.5% reduction in turnover rate, and they actually looked at their cost per nurse turnover, which was at $50,000. So combining the 19.5% reduction in turnover with the cost per nurse, it yielded actually $9.75 million in turnover or cost savings. Using the assessments to personalize onboarding, this is actually one organization out west that was able to, through the customized learning and development plans that they created using the prophecy assessment results, were able to reduce the orientation time from 18 weeks down to 12 weeks. So they actually experienced a 33% reduction. With the 6 weeks saved in the orientation and onboarding cost of $1,540 per nurse per week, they were actually able to save $9,250 per nurse in onboarding cost savings. This is a health system that was actually able to improve their retention, both voluntary and involuntary, and they've actually stayed under the 50th percentile, which is recommended by the advisory board. So they've actually seen success in both voluntary and involuntary turnovers through identifying the competencies in the nurses. So now I'm going to turn it back over to Tom, and he can speak to the ROI and retention and the impact on the organization, how they've been able to calculate ROI. Sure,
thanks, Felicia. So in our process, we talk to a lot of health systems, and Felicia, you do it because you're on site with the implementation. And we're trying to provide value because implementation takes a village, and you have to have everyone with some buy-in. And when you show people what they're going to gain from this, especially nurse leaders, there's a lot of impact on the bottom line. So we've created this tool that we run through with folks. I'm actually going to pull this up here that we use. And these are estimates, and for your health system, it's going to vary. But for example, if you have a facility with 700 beds, might equate to about 1,400 nurses. We're being conservative. If you have a 15% turnover rate at $40,000 cost per nurse for that turnover, this is the amount you're looking at. If we can, we've proven it with other clients, but for you, if we can even conservatively take you down 5 percentage points to 10% at the $40,000, you're looking at a cost of $5,600,000. It's a difference of, almost $3 million. That's a significant impact on your organization, and then you start to look at perhaps a larger system, right? With 1,000 beds, what that means for nurses, and you may even have more. And you're looking at plans. So these are significant improvements, and what we've done and what we've helped people achieve is it's not a Band-Aid. We're trying to get to the root of the problem in the hiring process, in the onboarding process, in their continuing development, because studies will show, we have even internal studies that show that nurse satisfaction has a lot to do with their placement and their relationships in their units. So when you have a say in that, and when you help them, find where they can be successful, it's not only about keeping them and keeping them happy. It's also about the health of your organization as well. So Felicia, any other thoughts before we go to questions?
Well, I think you mentioned the nurse satisfaction, and we have seen organizations that have experienced a significant improvement in nurse satisfaction by the personalized onboarding and customization experience. So with that, they've also been able to experience increase in retention, even using the assessments in the onboarding and development process as well.
Great. A few questions have come in, and we'll kind of address those maybe conversationally. Someone asked about what kind of impact that might have when you talk about onboarding with a preceptor or the preceptor relationship. Does this come into play?
Oh, that is a fantastic question, and I love that question. With the preceptors, you actually have the ability to match the preceptors to the clinician based on personality attributes. They also have a development report that's provided with a behavioral assessment to give them tips into effective onboarding. So that is very useful, and they've been able to customize the onboarding process with that and measure the impact as well. And we do have a preceptor competency assessment in addition, so that we have a lot of organizations using that as a precursor to entry into those formal preceptor programs.
Sure. Another question has come in regarding, we have 3 competencies that we measure, right? Clinical, situational, and behavioral. And we come up with a Prophecy 1 score when you use all of them. How strongly do you recommend assessing people on all 3 competencies?
Actually, no. The best way, the optimal way for the Prophecy 1 score is to use all 3 components. In the original validation study, they found that behavioral and interpersonal played the 2 most critical roles into the effectiveness and success of a nurse. So much that the nursing supervisors in the original validation study rated the behavioral at 42% and the interpersonal competence at 32%. The clinical could be taught, they felt like, and so the clinical actually it provides hard job knowledge, but also opportunities for remediation. But using all 3 components can really provide that customized, individualized onboarding process, as well as identifying your best candidates up front.
Another question came in regarding the validation study. Could you talk about what that measured and how that happened?
Absolutely. Yeah, so the original validation study was a 3-year validation study where we took prophecy assessments through with 3 large health systems. And what they did was they took all of the over 800 nurses through the competency assessments, through all of the assessments, and then they took their nursing supervisors and had them rate them according to 19 job performance dimensions. And what they were looking for was a very close correlation between the actual test scores and the actual job performance, and they absolutely found that in the analytics and analytics piece in the validation process. So that was very, very helpful, very useful, and we've had organizations be able to replicate that and have found that to be true in their outcome studies as well across the country.
Great. Another question regarding updating. Do you update the assessments based on new regulations and new guidelines?
Great question. Typically, the standard is around every 3 years, which is similar to the National Practice Certification assessments that you'll find at professional organizations. But we do want to make sure that our content is evidence-based, number one, that it is relevant to practice, and that it can be transportable across the country in the way the test items are created.
Great. Okay, one more question. This is regarding, it might be semantics, but we said that we have assessments in healthcare specialties.
Yes.
Is this just for nurses, or does it go beyond nurses?
Another great question. We have a very smart audience out there. So as far as being available to others besides outside of nursing, we have assessments available to allied professions such as respiratory therapy, speech therapy, occupational therapy, and physical therapy, as well as we go into, we have assessments for CNAs, as well as the surgical tech arena, medical assistants, and so we have a number of assessments available for those in the allied, and the behavioral assessment that can be used for non-clinical roles as well.
Yeah, and I actually, I know that to be true, and that being a great tool for human resources, they use behavioral anywhere from the public affairs and public relations office to, sanitation and custodial services. So, yeah, it can be used across the enterprise. If anyone has any other questions, and obviously this wasn't designed to be a product demonstration, so we are more than happy to give anyone a product demo where we go in to Prophecy. We will show you the 3 types of assessments in detail, what some of the types of questions are, and the analytics tools. I mean, nurse leaders love that because it's at their fingertips. And you saw from that other slide here, I'm going to just scroll back up. This one here, when you take all your applicants, right, and you can kind of see, I call it rack and stack. We can see exactly where the high performers are, where people are falling below the angle. And you can look actually retrospectively too, if you see that someone's having an issue, and where did they fall when they were hired? Because we know there is a shortage, and people hire for different reasons. The more intelligent you can be with the more data you have in that hiring, the better off you're going to be. So this is really great for nurse managers. And then two, one of the other things that we find, we hear anecdotal stories from people that use Prophecy, and they look at job fit, and job fit's really important. And so you'll have, and you know this, Felicia, you'll have a nurse that all of their life has wanted to be in the ICU or in labor and delivery or in the ED. And they get there, and they're actually not suited for it. And they don't find out till I'm not going to say it's too late, but there needs to be adjustments. And we have clients that go in that adjustment period to help that person realize what their next step could be, or what kind of decision they can make based on what they're finding statistically.
Right, and the best fit or the job fit is very helpful when looking at nurse residency programs or with new grads, especially if they don't know quite where they want to be placed. This has really helped organizations to effectively place them so that they can be successful.
Exactly. All right, so that's the conclusion of today's presentation. Again, we'll be reaching out to you individually to make sure you have all the information you need, answer any questions, and again, give you a product demonstration, and hopefully at some point welcome you to the Prophecy family. Take care, everybody.